Namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is a live show every Sunday. We bring experts from Apollo 24/7 to this live show where you can join us and ask all your questions and queries that you've been postponing to ask or postponing to visit an expert. So here's a chance that you can talk to our expert and you can type your question on the YouTube chat. This show is live streamed on YouTube, Facebook, and Instagram profiles of Apollo 24/7. So if you're watching us on any other platforms, if you want your question to be asked, please do jump onto the YouTube chat, type your question and query there with all the possible details like age, gender, kab se kya le rahe ho, and all your problems in detail so that I can place the question before our expert who's going to join us today. Also on this show, we're going to have a health quiz where you can win prizes from Apollo 24/7, and I'm going to give you gift vouchers as well. So please stay put, please stay whole. Towards the end of the show, I'm going to give you all of these. Also, this show will be recorded and will be on the Apollo 24/7's YouTube channel, available for all of you for a recording. And if somebody needs this recording, if you think that they require a topic of solutions from this chat, please do forward the recording to them, and also subscribe and like our channel so that you can see this wonderful these content keep coming up. You will not miss any of our shows. तो चलिए, आज का टॉपिक है ईयर पेन. कान में अगर दर्द होता है सो दुनिया तो बंद ही हो जाता है यार. सो लेट्स अंडरस्टैंड व्हाट्स द कॉज ऑफ ईयर पेन एंड हाउ डू यू गेट रिलीफ. व्हाट कैन यू डू एट होम एंड व्हेन डू यू मीट योर एक्सपर्ट. आज के एक्सपर्ट है काफ़ी interesting expert है. So let me introduce Dr. Subhankar De, who is an ENT head and neck surgeon from Apollo Multi-Speciality Hospitals, Kolkata, with an experience of more than 20 years. He can be consulted for ear, nose and throat diseases and surgeries of oral head and neck cancer. He is a member of Association of Otolaryngologists of India, Foundation of Head and Neck Oncology, and he's published papers in Fronto, I will not be able to pronounce it. So vision and eye deformities and their correction में sir ने papers भी publish कर चुके हैं. And आगे है sir. Good morning sir. Welcome to the show.
Good morning. Namaste.
नमस्कार Dr. Subhankar. Wonderful to hear you. कान के functions अगर मैं बोलती हूँ तो primarily it's hearing, but then there are a lot of other functions that it does as well, balance and other stuff as well. But we do ignore our ear health in many ways is what I believe. And we are misinformed about ear health. काफ़ी सारा जानकारी हमें ear health के बारे में होता भी नहीं है. And with that lack of awareness, we tend to do a lot of harm is what I understand. So let's understand the ear properly from an expert himself. So what can cause ear pain and how important it is to take care of our ears?
The pain in ear, there is something happening wrong in the ear. So that is for sure. So most of the time, the first thing we should do should not ignore it, should address. And actually, the ear pain has different kind of problems in different age groups. For children, little toddler, my elderly people, they have different kind of problems. So most of the time, for very small child, the child will be just crying. So you don't know whether it's a pain from the ear or pain from somewhere else. So parents get very confused that what's wrong there. Very rarely, sometimes very small child, then putting a finger, just showing the ear is there something wrong. Then they realize that something is wrong in the ear. So in that case, I think that if the child is unwell, very say less than 1 year old child, so having a very common cold, runny nose, and they get up in the night from the sleep, crying. So these are the very common scenario of ear pain, and especially happens in the winter months or colder months, or if you are staying in a very cold places and all, or if the child is little allergic, runny nose, cold. Some types of children are that they suffer like that. So I think immediately you should consult your pediatrician and bring bring it to the notice. And they are very expert to judge the source of the pain. So once they find the pain is in the ear, so they can manage the basic things. If they think that it is necessary for an ENT opinion, they very frequently they ask for the ENT opinion and go and advise. I'm talking about this for the very
के
side
लिए
standard.
इमीडिएटली ईएनटी के पास जाने का जरूरत नहीं है. व्हाट आई अंडरस्टैंड इज इन केस
Um,
बच्चों में प्रॉब्लम है तो पहले पीडियाट्रिशियन से संपर्क करें, उसके बाद में देन यू विल बी रेफर टू द राइट
because
पर्सन.
why I say this, because most of the time all the children, they at this age group, they are under very close observation of their particular pediatrician. So the parents, they know the pediatrician very well, and he becomes a very close, friendly, and all. So they can easily approach him. And
Correct.
of course, if you have a ENT surgeon available nearby you, definitely you should come. That's not an issue. But
Correct.
most of the time, we get the input from our pediatrician friends.
ओके सर, एज यू सेइंग कि एज के हिसाब से बदलता है एंड बच्चों में भी बदलते आता है.
And the types of
व्हाट
problems.
एज, यस, व्हाट एज ग्रुप यू नो ए वेरी क्या क्या करता है, कौन से कॉजेज जैसे ए बचपन में होता है, देन यंग अडल्ट्स एंड देन सीनियर्स में क्या होता है, व्हाट आर द डिफरेंट टाइप्स ऑफ पेन्स दैट वन कैन एक्सपीरियंस?
So age-wise, if you make the difference, as I said, the first one is the group of less than 2 year old. So they come up with this kind of a peculiar problem that you, as a parent or as a caregiver, you don't know what to do about it, and you don't know the problem was here. Little
करेक्ट.
elder, say 3 year plus to 6, 7 years old, these children, they can tell that yes, I'm having a ear pain or this particular right or left ear pain. So that the job becomes easier. The remedy becomes quicker because they can address the ENT surgeon straight away,
करेक्ट.
or a pediatrician who is very available to near to them. Then let him decide if it is a simple thing or not. And this age group, 3 to 6, 7 years, is a peculiar. This toddler group, they play with lot of things, and they sometimes put some things in their ear, foreign
राइट.
body, like small playing objects, some small plastic balls, kind of a thing, buttons and all. And because it is gone inside the ear, most of the time it is not seen from outside. So the child is staying,
इट इज.
and unless you go to an ENT surgeon, it's very difficult to find it out. It is really happening there, and if it is there,
या.
then I don't think so. The other specialty doctors are being able to remove it because for that you need special equipments and special setup. So then ENT
या.
surgeon has to be considered. So that age group is a different thing. So if your children are at home, suppose you're not directly observing them and they come up with this kind of issues, always keep in your mind that this could be an issue that they have put something in their ear. So this age group I'm telling, less than 2 years, very unlikely, very rarely, but this age group, they come with this kind of problem. Wax is a problem, accumulation of wax in the ear and getting very much thick and very hard, and it's putting pressure on the ear, that gives pain, and this age group is also there. Then cold, infections, runny nose, flu-like syndromes is very common in this age group also. Tonsillitis, adenoids problem, they also add up to this. Then little elder, when you go say 12 years plus age group, for is very common thing. Foreign body can happen them also, but this is very unlikely for a 12 year plus keep putting
करेक्ट.
something inside. But
Right.
once
So अनजाने में नहीं
they
होता, but accidentally it might happen, but you know, knowingly they might not put
sometimes
anything in.
children the habit of having itching, so they get something
Correct.
pen or pencil they do, and they may injure the ear. So that can happen.
Oh,
And sometimes in fight, children, you can't trust them. They can do
correct,
any kind of
correct.
thing.
Yes.
But
So
another thing is that this
the Dr. Garu, one quick question here.
uh,
External object का आपने बता दिया है कि something goes inside, then you will have to come and see a specialist with special equipment. ये मुझे समझ में आ गया, अच्छी बात है, and वो भी emergency है. बट बच्चों में आपने जैसे बोला है कि कोल्ड है, सीजनल चेंजेस की वजह से हो, टॉन्सिलाइटिस की वजह से हो,
yeah,
ये कांस्टेंट होता है टिल द टाइम दैट दे ग्रो अप स्लाइटली ओल्डर. तो ईयर पेन, आई अंडरस्टैंड माय नीस ऑलवेज कंप्लेन्स ऑफ ईयर पेन व्हिच इज related to her cold. So
exactly,
this is a
and it's very
constant,
common.
very
It's a
common.
very common thing. Very
Yeah.
common
So
thing,
how do we
especially in the
address
winter.
those?
Another thing is ear pain. You can find out when you have a very recent air travel. So traveling in flight, so that can give you. Suppose you're traveling by flight and you are having a cold at that time. So very frequently we will end up with ear pain, and that happens for adults more rather than children. It's not only children alone. Even adults also can have very severe ear pain in those situations.
Right, sir. So our audience has started to ask questions. Lovely to see
Sure.
our audience
Let's
coming.
take the
Our
question.
regular audience are also here. So I welcome all the audience to ask their questions. And Raman Venkatraman ji, will you please mention your age, because hearing loss के बारे में बात करना है तो age plays a very very important role. So age and any other medical conditions, I'll appreciate if you can type that. I'll take your question very shortly. Manish Sharma ji, Jyoti, Subramaniam, Archana, I'm going to take your questions shortly. So one more question that will before I take audience's question. कॉजेज जो भी हो, ईयर पेन को इग्नोर क्यों नहीं करना चाहिए? व्हेन कैन यू टेक इट लाइट? व्हेन इज अ रेड फ्लैग दैट यू हैव टू गो आउट एंड मीट अ प्रोफेशनल?
Say as children never should take it light because there may be a foreign body, one thing. Another thing is that if something is wrong there and you bad, and for a child to bear it is very difficult, and for adults most of the time they ignore because maybe that pain severity is not so much, he can manage, he's busy in work. Most of the time the adults that these things happen, and there is some problem in ear for especially for adults, that this pain is not so severe, and the problem is going on inside. The type of the problem is that the pain is not severe, so doesn't mean that the problem is not severe. Only this expression as far as the pain is concerned, that is very low. So there is kind of damage going on, and if the pain is low, we can manage it, or some once or twice we can take a painkiller and we manage. We keep on working and in our own work. Then when it happens, by the time you reach the doctor or you see the doctor, the enough damage has been already done, and you are already dealing with a complicated state. So that can be prevented for adults, especially I'm telling. So don't
Correct.
ignore it, address it early so that we can solve the problem when the problem is less.
Right, doctor. So, first question that I would want to take is about CSOM. I'm not sure what does that mean, doctor. What is CSOM, and can that be resolved with
CSOM is an
medications?
abbreviation. Yeah, it's a diagnosis kind of a thing we write in our prescriptions. It is called chronic suppurative otitis media.
Okay, so Archan Behra is asking this question. So, can CSOM be cured with medicines?
It can. Actually, what is CSOM is that chronic suppurative otitis media. First of all, it's chronic. That means it is happening for a very long time. Suppurative means ear is discharging. Otitis media is inside the ear. The ear drum is there, ear membrane is there. Behind that, that cord area is called middle ear. So some inflammation or infection is going on there, and that is creating some fluid extra production, and that is coming out through a perforation in the eardrum, and that's why the ear is discharging. So we are dealing with an ear infection for a significant good amount of time duration, and we have a perforated ear and it is actively infected, and because of that some discharge is coming out from the ear, and discharge is sometimes on and off. Say for 1 week discharge was there, for another week discharge was not there. It's not that the discharge has stopped totally, but it's coming back. So that is scenario is CSF. So medically, what you can do about it? First thing that we have to reduce the inflammation and infection, obviously by medicines. After using the
Yes.
medicine, we should to observe the patient whether the things are improving or not. It can happen that if a CSF which has not become a CSF, I mean it has not become chronic, it is still in early stage. If the medicine is given in proper time, it cures, it improves. And once it becomes attains the stage of CSOM, very unlikely that simply by medicine it is to be controlled by medicine. So it should be observed periodically. You should meet your doctor. So after he will be giving you some medications, and you go back and see him. Say at least 2 3 times once he sees, and he is the right person to judge because he can see inside there what's happening there. Then he can say that yes, right now it is done. You are cured. So otherwise, just by saying a
So,
CSM, most likely
management.
no. Most likely only by medicine, CSM getting cured is very unlikely.
Right.
It
So,
can be
see,
possible
chronic.
to start.
Yeah. So, sorry, doctor. Can you please repeat that last line?
What I mean, if the disease was started, the treatment was started very early, then it's possible to get it treated, cured by medicines. Most of the time, it doesn't happen because the name itself is chronic because it has been there for a very, very long time.
हाँ. So,
So
early
there,
act करो और अच्छा manage करो.
ekdam, ekdam.
Right, sir. So, thank you so much for answering that question for Archan. And, sir, तिलगमणि सुब्रमण्यन जी का क्वेश्चन है, what are the reasons for pus like formation in one ear, it is not appearing in both ears?
Interesting thing. A lot of times we find this question from patients that, sir, I have a problem in my right ear. Will that affect my left ear? The answer is no. Don't worry about it.
Okay.
Both the ears are not directly connected to each other. So one
Ah,
ear problem is not going to affect the other ear. Don't worry about it. You have a
okay.
problem in the right ear, it's the right ear issue. Left ear is fine.
Okay.
Nothing to worry about left.
Right. So good. So the reason of one infection cannot create the same problem in the other ear, but you need to take care of the ear. अगर लेफ्ट ईयर में
When you
उनका प्रॉब्लम.
come, yeah, when you're coming to see the doctor with your right ear pain, so doctor obviously will check the left ear also. So nothing to worry
Right.
about it. You will take care.
Yes. So I'm going to continue the next question. Manish Sharma ji, जो हमारे regular viewer है, he is asking this question. I had ear pain in my left side. I also he also used earbuds. Maybe due to that I had ear pain, but I got relief by using ear drops combination with clotrimazole, neomycin, and lignocaine, and which are bought from the pharmacy. Now, Manish ji has opened up a Pandora's box of what we all do. पेन होता है, फार्मेसी जाओ, ओटीसी में जाओ, जो भी है वहां पर हम ले लेते हैं, इमीडिएट पेन रिलीफ हो जाता है. वी हैव नॉट गॉन बियॉन्ड दैट, पेन रिलीफ हो गया एंड वी हैव नॉट एड्रेस द एक्चुअल इश्यू. सो वेयर हैव हाउ डू वी करेक्ट दिस पैटर्न?
Actually, it's not only the with the UNT problem; it's a common Indian problem. So um, the three medicines he has taken is a combination of three medicines he has taken. One component was the lignocaine. So the lignocaine is a local anesthetic. So once you
Correct.
put that medicine, and other two are the one is antifungal, one is antibacterial, and one is some local anesthetic. So if you put a local anesthetic, your pain obviously will come down. And we do not know the reason for the ear
Pain.
problem. So you are putting an antibiotic there and putting a local anesthetic there. So your pain may be temporarily coming down. If you do not have an infective condition, first of all, there is no role of doing any antibiotic any work there. So you are unnecessarily medicating yourself. Suppose you are putting a wax there, so this medication is not going to help you anyway. So yes, you can get some pain relief because of the lignocaine, not because of the antibiotic. We do not know if there is an infection. Also, you can get some relief. So this is very unpredictable and very unscientific way of dealing with this. Rather, if you have really a pain and even in the night, so you won't be able to have a doctor at that moment. What you can do, take a painkiller, take a simple paracetamol, which is there in everybody's house. It's a very safe
Orally,
kind of
not in
orally.
the
Take
ear.
a
Ha,
no,
not
no,
in the
no, not
drops form.
necessary.
Orally.
No, drops is a very specific medicine. Give the drops after seeing the ear. That should be. If you want a pain relief, why don't you take a simple paracetamol, which is very commonly available. Almost all the Indian houses they will have paracetamol. You should keep it. Take a paracetamol. Next day morning, you go and meet your doctor. Even if you don't get a ENT specialist nearby, you can generally meet a general physician and he can decide. Then, if he is saying he can give you some medications or he can suggest you to go meet an ENT doctor. That's a better way of doing it. And pharmacy people, just for selling the medicines, they do. So let's not, as you said, that we're opening a Pandora's box. I believe it, but I think awareness has to come up more than rather than blaming somebody. So let's we all be aware, take care of our health, and be healthy. That's the better way of doing it. Slowly, slowly, it will happen. I hope.
Correct, correct. We have to spread the awareness that this is not enough. The second point that Mr. Manish had pointed out, that he used the earbuds and he suspects that that is the cause of his pain. So, usage of earbuds, I have heard enough of ENTs telling us that do not use anything in the ear. What is your advice?
See, earbud thing is so commonly available and so frequently used. Even if all ENT surgeons we say that don't use it, I don't want to say that don't use it. The main issue, the problem is that we do not know how to use it. That's the main issue, and
Correct.
sometimes we do harm by using the earbud. So one interesting thing I'll share with you. If you see a earbud, there are two cottons on both the sides, not a one side cotton.
There
Cotton
are
buds
two.
is there on both two sides. Have you ever thought about it? Did you ask her two side cottons? Why not one side?
Correct. कभी सोचा नहीं था सर.
See, if you put a two side cotton, what will happen? You will not touch one cotton because you want to use it, you want to keep it clean. So obviously you will hold the cotton bud in the middle,
Right.
in the stick, and you will not touch the cotton either side. So by doing this, you reduce the length of the cotton bud to half if you hold
Oh,
it in the middle. So with this
okay.
much of length, if you try to clean your ear, most of the time it will happen that this length will not go and reach to your eardrum, which is far more inside. So eardrum will be saved. That is the reason that earbuds are designed both way cotton. Because if you keep one way cotton, the length becomes more. So you will be trying to put it more and more inside.
That is an
So that's
interesting
why it is
observation. Thank you.
designed in that way to save this injury. Another point is that cleaning with earbud, most of the time it gives pleasure sensation to people because you're having itching, so you itch and you think that I'm doing good. So by doing this good, you get carried away and then you put it very much deep inside, then you injure your ear. So that's the thing we
Right.
don't want, and it's very difficult to tell each and every person to do it this way, that way. That's the reason that ENT surgeons say that don't do it because sometimes you injure it. But before doing it, is very important that your ear which you want to clean should be very soft enough. So softening ear drops and make it very liquidified and just clean externally, just outside, not inside the canal. If you can do it just externally after your bath or something, as a regular habit you can do. But sometimes people do it every day, which is not at all necessary.
Okay.
There are people who have not cleaned their ear for ages. Nothing happens because God has given a fantastic mechanism of inside the ear which naturally cleans it out. There
Correct.
are some exceptions. So for some people, the production is more, the type of the composition of the wax is different, so they're very sticky, it's very hard. So for them, they need doctor's help. But not in general, everybody needs to clean their ear. It's not true. So
Very beautiful.
if you are trying to do it, most of the time you injure rather than doing harm.
Yes. So here's a question which I think most of the mothers will want to know. Veena Tiwari ji is asking this question. Sir, what is the solution if my kids do not want to, they don't let me clean the ear area as it feels very ticklish and it's very hard to stay, managing the children to stay still is difficult. So mothers want to clean the children's ears. Is this advisable? अगर करना ही है तो कैसे करना है? एंड बच्चों में ये ड्रॉप्स जो आपने बोला है कि सॉलिड लिक्विड लिक्विडिफाई करने के लिए डू आर दे सजेस्टेड फॉर चिल्ड्रन.
Uh, just for the wax purpose, what we suggest the mothers is that you can put the ear softening solutions are available. Medicines, not that just like this. Medicines are available there, so you can
Right.
use them. That will be that will soften the wax, that will liquefy it. Once it is liquefied, it is easier to clean by earbuds. And once it is liquefied, it reduces the pressure, and the children will be giving more cooperative to do that, because once the wax is hard, it is itching them and they get apprehension that it will hurt them. That's the reason that they don't want to do it. So you can do
Correct.
it, but after putting adequate number of ear drops to soften it. Then, and if you are not
ओके
confident
सर,
enough doing it, or the
ये
child is not
बच्चों के लिए
letting,
भी अडल्ट के लिए भी है सर, दोनों के लिए है बिकॉज.
the drops can be used by adults also as usual. That's not an issue. But what is very important that if your child is not allowing you to do it, not letting you do, and you are not very confident of doing it, don't do it. Just take him to a doctor. He will do it, because otherwise it may be injurious to the child's ear.
Right. One simple question that Rakshak is asking, Rakshak AR. What is the reason for the wax seen in few kids? And some of them have dry powder like texture. What is this difference between wax and the powdery texture?
As just now I told, the as we are different human beings, our everything is different. I look different than any other person, so my wax formation is also little different. So don't take it as a disease. We all have wax formation, some little more, some less, some different compositions. So that's perfect. Nothing to worry about it.
Okay, sir. So, Mr. Raman Venkatram is asking about his. He is around 70-year-old and he's going low on his hearing. He's having a very active lifestyle, but presently retired. Heart value replacement surgery TVAVR in February 23. That is his case history. But hearing loss gradually हो रहा है. So there's no pain attached to it.
For his age, 70-year-old he is, so hearing loss is very usual. So as if I reach that age of 70 years, I'll also losing little bit of my hearing. Our vision is going down, body is going down. So this is a natural process. There's not disease about it. He can go and do an hearing testing, hearing check in the ENT clinics or audiology clinics, and once they see there is no problem other than this, so basically it's a very age-related hearing loss. He can take some support of the hearing aids, and which is very simple thing to do, and they should not think about disease about it most of the time. Unless we have seen the inside, we cannot say that there is no disease. Yes, there is a possibility, but commonly what will happen, I see, that is age-related hearing loss. He can use a hearing aid after checking the hearing power.
Great, sir. Thank you so much. And Jyoti ka question, her next question, Ms. Jyoti is asking, my left ear is always itching continuously. Now let's come to this topic of itching. Pain is a different thing, itching is a different thing. So what is this trying to tell us? Itch क्यों होता है?
There are basically two reasons. One is infection and is not infection. Infection you will get itch obviously because the skin is getting irritated. That should be treated by cleaning the ear and using antibiotics. Sometimes only drops, sometimes drops associated with tablets also. Depends upon the severity of the case. Suppose we don't find any infection there. The other reasons is yes, wax is always the reason. Wax can give you irritation there. And another thing is that some people have very dry skin, and that's a
Yes.
type of skin. It's not that say you are in a colder place you will get your skin type is that. Once you get a dry skin, then the skin will be always irritating. So no infection, no other problem, only dry skin. This can happen for those people. Once we examine and we find there is no other big issue, we suggest them you can use some Vaseline. Take some little Vaseline and apply in a cotton bud or in the ear with hand also. Just apply it, smear it in the ear canal, just in the front. That's all. And
That's
if the
it.
itching is too
Okay.
much more, you can use some anti-allergic tablets for symptomatic relief for a very short period.
Yes. So Amol, who is 38-year-old, सेम क्वेश्चन पूछ रहे थे, उनका भी समाधान आपके आंसर से मिल गया है. One question and one answer. No, many questions in one answer. Let's Raman is asking, my friend gets frequent earwax removal done. I'm having ear pain for a while now. Should I also get my earwax removed? And through whenever I put ear buds, I don't see much. No, acha, though I put ear cotton earbuds, I don't see much earwax in the ear.
So he should be happy about it. He doesn't have a problem probably. Nothing. Just because his problem, his friend is having, is not necessary. But still, if he has a doubt, he can have a checkup with any his nearby doctor
Right.
to just see if there is
Right.
anything wrong.
Right. So Mr. Subramanian, who had asked about 1 year discharge, he's come back. He's 47-year-old male, and he has right ear infection, pus-like formation with unbearable pain, and it happens once a year. Lifestyle is more of travel oriented lifestyle. So does this have any kind of implication on his ear pain?
Um, if he is having a recurrent discharge and if it is recurring, not getting problem, so that means the problem is not solved totally. Rather, because traveling should not be an issue. There are a lot of people who have to travel in present days, so he can continue his traveling as the job he is doing. It needs traveling. He can do that. Just have a routine check with the ear if there is any local issue. I think the problem is not very big one, and it can be addressed very simply.
I
Nothing to
think
worry
you've
about.
said it so very beautifully, sir. Sometimes we fear the problem, we think that the problem is very big, and we avoid that problem. And sometimes बहुत ही छोटा समझ के भी प्रॉब्लम को अवॉइड कर लेते हैं एंड बड़ा होने देते हैं. So, as you said, going and meeting your physician is your first step.
The problem is we have a fear inside our mind that if I go to a doctor and he will tell me I have this problem, so what will happen to me with big or less? We start thinking about it. Actually, doctor will tell you what the problem is. So the advantage is you have know now you know what is the problem. You can do something about it. You do not know
Hmm.
a problem and you cannot solve it. That's more rather worry, I think. So nowadays, well, especially I can tell you about this about the cancer. People try to avoid treatment because doctor tell me I have cancer. So even if you have any whatever cancer or whatever any kind of problem, if you know the problem, there are solutions. Nothing to it.
Correct.
Let's start
Correct.
solving the problem rather than getting fear out of it.
Right, right. So I think you should go get yourself checked, and I think you should be relieved of your pain. If there is a management with medications or anything else, I think you will get your own solutions from your physician. And
Any
Dr.
problem you
Subhankar,
should
they
get
can
early.
be
Yes.
consulted on Apollo 24/7 as well. We've left a link to his consultation. Please go ahead and book if you require a consultation. So, sorry, you were saying something, I overlapped.
No, I mean, if any problem is there, we can address it or we can identify it early in the stage. The treatment becomes very simple. You don't have to suffer
Right.
anymore. So here and just see your doctor, and it can be solved very simply. Nothing to worry about it.
सुपर थैंक यू सर सो नेक्स्ट क्वेश्चन इज एन इंटरेस्टिंग वन काफ़ी सारे लोग ये करते रहते हैं हम लोग रमन जी पूछ रहे हैं wearing a bluetooth device for long will this create problems in the ear and not just bluetooth sir I would want to bring you to your notice that आजकल हम लोग पूरे headphones के साथ काम करने वाले ज़माने हो गए and also earphones हम लोग इतना यूज़ करते हैं earbuds यूज़ करते हैं what are the precautions that one has to take and will this cause some kind of damage to the ear.
See, Bluetooths are not new. It is there for very. But what I have noticed in recent practice from this lockdown period onwards, lot of children they came up with ear pain, ear infection because they had to use these devices, and
Correct.
especially ear knobs, which commonly we use for listening to music. And I've seen people traveling in car, metros, or wherever. So especially
Mm.
young, they put the earbuds in the ear and keep on listening to music and in now in music. But the problem is this earbud which we are using, we are putting in our pocket or they're hanging down. So they're all sorts of dust and elements, and we're putting back them in the air. So and
Correct.
try to get a good fit, which sometimes like this nicely
The
fitting. So rubbing those dust and all against your skin. So they led to lot of infections in this lockdown period. I met at least one or two children every day with ear infections who are
okay.
attending this online classes. So that was a
Right.
pandemic kind of situation with ear pain with children like that. And as you said, there's Bluetooth issue. Yes, Bluetooth is a different thing. Bluetooth is having electromagnetic radiation, so that will definitely give you some kind of radiation exposure, and you get a chronic kind of a pain, very dragging kind of a pain sometimes. Sometimes you feel that your ear is heated up, is warm, got reddish because of the radiation exposure. And some people who are very sensitive, they come up with as soon as I use Bluetooth for 10 minutes also, I get my pain and all. And sometimes even without using Bluetooth mobile phone also they get this kind of pain. So
Correct.
what I
Correct.
found is this sensitivity to the radiation varies person to person and very difficult to classify that. So in
Correct.
general, what I say, try to avoid Bluetooth kind of a device, any wireless kind of a device. If you can use a wired device, which is attached electrically, so that will give you only sound energy. That will not give you electromagnetic energy. So that will be probably the less thing, but you have to make sure that those ear knobs you are repeatedly putting in your ear and bringing it out, they should be clean. So it is not possible to sterilize them each and every time. So you can carry a small sterilizer in your pocket or handbag. You can put the sterilizer in your hand for just disinfection. That's everywhere we are doing a post lockdown. We should not stop it. It's a very good habit. We should all do this. And while we are putting the sanitizer in our hand, try to rub this sanitizer in this ear knobs also. That will prevent you to get more and more infections, and that has helped a lot of children and adults which I have been advised because you cannot avoid it. You have to take it on because our job pattern, and the work pattern has changed, and this change is permanent probably.
Yes, sir. Because hygiene is here to stay, and no amount of stress on hygiene is less. So always
There is
in
no
your hygiene
alternative to
practice.
hygiene.
Yes, doctor. Absolutely. So next question is Mr. Jagjit Kaur. He feels irritated on hearing sharp sounds. Is this normal or do I have a problem?
Uh, how old is he? Did he mention?
No, he did not mention, but Jagjit ji, can you please type how old are you and what kind of work do you do? That will be helpful. But sir, I also have noticed a lot of children who get irritated with sounds, and they have other
I
issues as
answer
well.
it because people, when we grow older, we slowly lose our hearing. I'm talking about normal scenario, not a diseased one. So when in the early stage of hearing loss, which is age-related hearing loss, this phenomena is very common. Nothing to worry about it.
Sir,
For
Jagjit is 48.
48. So 48 is not considered to lose hearing for this stage. So we consider this kind of symptoms to come around 60 years. So 48 is quite perfect, nothing to worry. But if he is having this problem, so probably there is some amount of hearing loss happening, which is in very early stage. So he can go and check his hearing and talk to his ENT doctor nearby, wherever he is. Then he can prevent it by avoiding loud exposures, avoiding those electromagnetisms which are happening nowadays. And another problem which I found is that our stress level is also coming into effect. For his age group, this stress level problem is very much high. A lot of people are coming with this hearing sensitivity problem. They don't have hearing loss. They have the problem of having irritability to the sound. One thing. Another thing is that vertigo and imbalance kind of a sense. These are all stress-induced symptoms, so we can address them as a whole.
Correct, correct, correct. So, Jagjit I think it's important for you to go get yourself checked once and then rule out any problem. If it is only stress, आराम कीजिए, anxiety कम कीजिए. And if there's any physical problem, I think there is an entire expert panel on Apollo 24/7. We're always there for you. ठीक है. नेक्स्ट क्वेश्चन का रिस्पॉन्स आपने दिया है, थैंक यू सो मच. बोल रहे हैं मिस्टर रमन, हु इज 70-year-old हियरिंग के बारे में आपने बोला है, ऑडियोमेट्री टेस्ट के बारे में. ही हैज रिप्लाइड saying that he's already done an audio test and the companies have suggested a hearing aid for both ears. I'm thinking, is it to promote their products or is it compulsory to wear a earphone, hearing aid?
No, if they cannot promote like that, because hearing aid is a device which helps us to hearing. Like we are using spectacles because we are not being able to read properly, so we are taking help. So it's called a visual aid. So we are hearing little less, putting an hearing machine. So that's an hearing aid. So obviously it's a commercial product. So whichever place he has gone to, they have to sell it, and it's got a price for that. But no, for the promotion only, it's a medical tool, and it is really helpful. And they will properly check, and they will measure his hearing loss, and they will accordingly adjust his hearing power, and they can make it individually adaptable for his ear, his kind of hearing loss. And
Right.
he can, before buying the machine, they will put the machine on, and they will let him hear, and they will see how it is working for him. They will make it comfortable by doing a recheck. It's a medical tool and very established one, and it doesn't have any side effect. He can comfortably
Right.
take.
So it's again, how much you invest in it, what kind of company do you want to buy, all these, kya size mein kharidna hai. These are all your choices and options that market thrives on our own choices. So the rest is up to you, sir. But in case that you're advised, please go ahead is what doctor says. So next is Karthik. Son is 2-year-old, and we see that his ear interiors look very dirty. We visited a pediatric, and he gave us drops. How to prevent such dirt inside a child's ear in future?
If it is simple wax, nothing to do about it. It's nothing to worry. As I before, so some children they will have little more secretion, some will be little less. So as your pediatrician has given some drops, put the drops and go back to him. And if he discuss with him, if he thinks that he need to see by an ENT doctor, just go and see him. He can clean it up with the device. He is there with him, and he will tell you to keep the drops. Some kind of medicines are there which keep on. You can use it very long time also to prevent it getting accumulated again. But formation of wax is not a disease. It is for their
Right.
everybody. It will live more or less. Nothing to worry about.
So here's a question again related to wax only. Suresh Sharma ji पूछ रहे हैं, I'm suffering from stubborn and hard earwax, which is also affecting my hearing. Please suggest a solution. So is there a link between hard wax and then less of hearing loss?
That is possible. Suppose the wax is there left very long time and it became very hard, so it is blocking the ear passage. So once the ear
Oh,
passage is blocked, so it's a mechanical block from the sound energy to enter inside. So you'll be having hearing loss. Sometimes this wax they can be so extensive that they can damage the ear membrane also, and it can
oh,
give you pain, local infection. So it can be cleaned up. Sometimes scenario is so bad or patient turn up so late in condition that it becomes so painful that we cannot clean it in the clinic. So we have to take the patient inside the operation theater, and there we have to give anesthesia to clean it because it is so painful. So that kind of extreme also happen. So if you are either unaware or just reluctant to address it early, so I I'll advise not to anybody to go up to that stage that you need that kind of a treatment. So if you have a problem early, just see that you can clean it very simply in clinic also. But these scenarios very often come up.
right, sir. So all
It
of
can
this,
affect you.
you've been mentioning कि पहले से ध्यान रखो, aware रहो, symptoms को mark करते रहो,
Address
and
them
visit your
earlier.
physician. Yeah, earlier the best. Yes.
Earlier the best. I'm not talking about preventive only. We should address, don't neglect it because most of the time the problems are simple, which can be dealt very simple treatment.
एब्सोल्युटली सर, बहुत सिंपल सा सॉल्यूशन है कि सिंपल जब है तभी पकड़ो, इसको कॉम्प्लेक्स बनने ही मत दो. Right. So
एकदम.
next question is, both of them are asking the same question. Archin Behera and Sahiti, both of them are asking how is cold related with ear pain, and how can I prevent triggering of common cold based ear pain?
Ear pain and cold is very commonly coming together. What is the reason behind is that there is a pipe which connects back of our nose to inside the ear. That pipe is called eustachian tube. The function of the eustachian tube is to neutralize the of ear and the nose. So ear is closed by ear membrane. So ear inside it is not exposed to the outside unless there is a perforation or a hole in the eardrum, which is a disease. So in normally I have a normal eardrum, but behind the eardrum I have an air chamber. So that's very important to have an air chamber so that ear membrane can move. The supply of the air comes through that tube which is connected to the back of our nose. So if you get a cold, stuffy nose is not functioning properly, or I have a sinus problem. So what the eustachian tube function will be disturbed. So it is not performing its duty of transferring air, equalizing the pressure, or draining out the mucus from the ear. So that's why during a cold time we get a ear block. Sometimes it can be pain. Sometimes it can be a very heavy kind of ear, not hearing, muffled sound, heavy kind of a sensation. These are the symptoms of eustachian tube block that can be treated by correcting the cold, and sometimes if it is more and the ear membrane behind the ear membrane there is no more air coming new, so we have to do a small procedure surgeries by removing the ear inside the ear the mucus plugs are there, we have to remove them, try to put artificially ventilation tubes and all that can be done, but those are in senior when the questions is beyond medication. So during the cold time, if you can control the cold, take medications and do simple blowing exercise and all, this thing not happen. But if it happens, if you are landed from ear pain and all, we can do simple test and examine and find out how is the ear functioning, eustachian tube functioning. We can treat that. That's not a big issue.
Yeah. So here I would want to bring your notice to our common practices at home. कि ठंड में ears protect करो, keep your ears protected, covered. ये कॉटन डालो, नहीं तो कवर करो, और हाउ गुड इज दिस एज अ प्रैक्टिस? एंड सेकेंडली, काफी सारे जगहों पे ईयर में ऑयल डालते हैं, एंड हाउ इज दिस एडवाइजेबल और नॉट एडवाइजेबल?
First thing I tell you about the oil thing. Actually, any oil doesn't have any medicinal value. So most of the time we put oil because my mother did that, or my grandmother did that, or her grandmother or grandfather did that. Actually, in those we think we didn't have a lot of medicines, not much of doctors, medical facilities were not there. So whatever was there available, home remedies, we tried to do that. And that
Correct.
is our ignorance also and lack of resources also. So let's not go back to 100 years back. Let's think about today's time. We have all the medical facilities. India is in a very good position medically. It is appreciated all over the world, our medical advances. So it's very simple thing, and any cities in India, ENT doctors, physicians, pediatricians available everywhere. That's not the issue at all. So don't put any kind of oil and all. It doesn't have any medicinal properties there. Suppose the other question you put is
And
that
covering ears,
coverage,
putting cotton.
cold. See,
Hold.
cold thing, no, it is personal. Suppose somebody who lives in Chennai, so for him cold, and somebody lives in Shimla, for him cold is different thing. Because somebody living in Shimla, very low temperature, genetically from 2 3 generations they lived there. For them, cold is very comfortable. But somebody lived in Chennai, for him the little cold also in the December also they try to wear this kind of. So this is subjective. Some people who are allergic, who have runny nose kind of a thing, change of weather, they suffer. Say in a house of four members of house, one person is there who suffers from cold. Other three are comfortable. That means your body doesn't feel comfortable in the low temperature. So that person should take a precaution if you have a problem. Otherwise, simple cold precautions as we take, as simple as that. If you're feeling cold, put some warm clothes. That's all. Nothing great about it or nothing specific about it. Some people who have problem, you should take care that if you're catching a cold, what you do, take decongestion medicines, nasal sprays. Some people having an asthma background, so whenever they are having an established asthma, their doctors will prescribe them preventive medicine also during
Right.
the. So these kind of basic precautions you do. It is not for blanket for everybody should take cover of this is personal. Unless you have a problem, don't have to put up all these warm clothes and all. Not necessary.
राइट, बट ये कॉमनली कहा जाता है हमारे घरों में कि अरे ठंडे हवा में मत जाओ, हवा अंदर घुस जाता है और पेन कॉज करता है। इज दैट ट्रू?
No, see, these are all this because of our myths and all.
या,
As I said,
करेक्ट।
if you talking about cold, think about Moscow and the kind of temperature they live in. So they are living comfortably. So that's not the issue. So don't worry
राइट।
about it. If you are feeling cold, take precautions. But in as such blanketly, don't have to. I see a lot of parents they put a lot of warm clothes, caps and all to the small छोटे छोटे बच्चे हैं उनको डाल देते हैं. So even the child is sweating. Yeah, he's not
या,
comfortable just because he can't stay it up. So don't do that.
करेक्ट।
Not necessary.
राइट। Okay, doctor. Thank you so much. And a quick question from Mr. Kumar, who's a 54-year-old. I hear ringing sounds and feeling of ears being blocked and sounds being heard with screeching sounds, and the sounds are with lesser quality or clarity as well. What could be the problem?
I was about to come about this. This is a very, very common problem we feel that there is some buzzing sound or ringing sound in the ear. And this sound, it comes more in the late nights, not in the daytime. When things are quiet, that time we start listening this sound, and there's something so irritating that you find it very difficult to sleep. So especially elderly patients, they suffer more about it, or 50 plus. Less than 50 years, very unlikely to get it. And because of these are early signs of hearing loss. The when the hearing loss is there, the age-related hearing loss, nerve hearing loss, those come, they start to present in this kind of scenario.
Yeah.
Scientifically speaking, till now we have not a very clear-cut answer about this problem. We are not very sure about the pathophysiology, what exactly happening. So there are few medicines available in the market, but they are not foolproof. They are not wrong medicines. They are established medicines. They are very safe, But sometimes we have used a lot of medicines. There are a lot of different procedures also to be done, but there are not very clear-cut answers to find exactly what happened. So what we do, we investigate and find out if any reasons for that. Sometimes we find the reasons and we can correct them.
Right.
So it is
Right.
that don't try to take some nonsense for just somebody told something like that. Go to a doctor, investigate, because these symptoms, this ringing sound symptoms can be an expression of lot of different kind of diseases. So let's find out what is the actual cause of it, and it can be addressed.
Right, right, doctor. There was a technical term and a question. राजेश पारिक जी का क्वेश्चन है, what is the best treatment for trigeminal neuralgia?
Trigeminal
Trigeminal,
neuralgia.
हाँ,
It is trigeminal neuralgia.
yes sir.
Uh, So actually, the term says that there is a nerve named trigeminal nerve, and there is some inflammation in the nerve, so there is pain. It expresses a pain. This pain, it is very severe sometimes, very burning kind of sensation, pain, especially on the face and inside the mouth. And there is physical relief for this by taking a medicine, and that needs to be taken a little longer duration of time. It comes down, and reasons are there. There are some specific surgical procedures also there for that if it is not getting relieved by the medical treatment. But most of the time the medical treatment responds to it, reduces the pain, and it gives a better quality of life. But you have to understand this kind of problems, any form of neuralgia, the nerve irritation, takes time to come down. So people, they move from this place to that place because they didn't get the relief. So be little patient, and this disease type is like that. It will take little time to settle down.
Right, sir. Thank you. And in connection with cervical spondylitis and vertigo, Joseph Raja Pillai ji is asking, 60-year-old having some humming noise in the inner ears. Almost 5 years say he's going through this problem. He also has cervical spondylitis. Is there a relationship between these two?
No, cervical
Okay.
spondylitis and vertigo is not related. Actually, if you go back around 30 40 years back, that was a medical concept that probably some receptors are there in the spinal cord which gives this kind of vertigo. But in the later duration of medical studies and research has showed that there is no such medical evidence as there at the moment that cervical vertigo and the cervical spondylosis vertigo is related. As he
Right.
said, he has
And
got a
hearing, sir?
problem hearing.
Cervical
Yes,
spondylitis and
it's a
hearing?
different. He has a cervical spondylosis. He has a vertigo. He has got a humming noise, and this humming noise is vertigo is related, not the cervical spondylosis. So he has a probably combination of uh, humming noise in the ear, decreased hearing, and a vertigo. So commonly
Okay,
when we
here
get
there's
this,
no vertigo, sir. The vertigo is another scenario. That's a different question.
okay,
Mr. Joseph Raja Pillai has only cervical spondylitis, 60-year-old, humming in ears from 5 years.
noise.
No vertigo here in
So
this
this humming
case.
noise and vertigo, they are related. What I mean,
Okay,
not the cervical
not
spondylosis.
cervical spondylitis.
No, no.
Okay,
Cervical spondylitis, because he's 60-year-old, is very unlikely that you will find somebody who doesn't have a cervical spondylitis at 60-year-old. So for him, if the cervical spondylitis is disturbing him so much, then he better meet a orthopedician doctor or a spine specialist. They will fix it up. That's not a big issue, but nothing to get depressed about cervical spondylitis because it is happening in our age itself. So 60 is a very common thing. Nothing to worry about it. It can be handled by simple exercises, and if it is very much, then need medications and all. But as far as this ear problem he is telling, the humming noise and the vertigo, yes, they are related, and there are diseases which can be controlled by medications and some procedures also.
ओके सर, थैंक यू सर। जगजीत कौर जी पूछ रहे हैं, अगर पानी बाय मिस्टेक नहाते वक्त या स्विमिंग करते वक्त अंदर चला गया कान में, व्हाट कैन वी डू स्पेशली इन केस ऑफ चिल्ड्रन?
If they are bathing in bathroom, in shower and all, water will not go anywhere. Nothing to worry. But only for the swimming time, if the water goes, suppose you are in a swimming pool, If the swimming pool is properly maintained, very unlikely that you get infected. Yes, that are possible because swimming pools are most of them are not personal because we are using a swimming pool which is community swimming pool
Common.
or in a club which lot of people are using. You can get infected, of course. So after the water has gone in, you can dry it up with a simple towel, or you can bend your head to that side, and the water will come out. It may take some 1 or 2 hours. The water will drain out. If the child is saying some problem, itching, pain, or you find some that area is become reddish, then meet the doctor. Otherwise, just water has gone in swimming pool water, nothing will happen because most of the time it is chlorinated and is with standardized thing. Unless the child has symptom, nothing to worry about it. And
Okay,
of
sir.
course, I'll prefer that when you put children in a swimming pool, take your proper precaution by covering it.
Correct. So
That's
one
what I
last
do.
quick question. I will conclude the questions here with this session. One last personal question. I'm a frequent flyer. I travel a lot, and I experience ear pain, especially during takeoff and landing, because of the air pressure. So, what can I do for this? Is this a common thing that everybody experiences, or there are certain population who experience it higher?
You see, for me, it is not very uncommon because being an ENT surgeon, I see only problem with this kind of people. But in general, it is not so common. A lot of people fly, but there are some people whose, as I said, the eustachian tube is coming to picture here. The eustachian tube function, if it is disturbed, then you can get this kind of problem. So, as he is a frequent flyer, he has to fly. So, what precaution he can take is that whenever you fly, use decongestion nasal sprays. You can keep it in your pocket,
Nasal
in
spray,
your bag.
but not
Nasal
the
spray.
ear.
No, not in the ear. Because ear is protected with the eardrum. The medicine will not go inside. You decongest your nose so that the eustachian tube is opened up and it is there properly. Decongest before getting into the flight. During the flight, you chew something. If food is provided there, you can eat the food. But rather than food, I prefer something chewing like a. You can use it if it is allowed by the airlines. Some airlines they have a distance with that. So you can use the chewing gum, keep chewing. Once you keep chewing, the jaw movement it improves the eustachian tube
Exactly.
opening function. And when you are traveling mid-air, there will be no issue. The issue comes more frequently during the landing.
Exactly.
So mm, nowadays, standard all the aircraft they mention that by the time they start their descent, the captain will announce that we have started our descent. They will mention that. And once it starts descent, what you should do, again keep chewing and keep your nose and mouth closed by your face, by your hand, and blow. I'm just demonstrating. I'm closing my nose and mouth both together with one single hand,
And blow.
like this, and blow.
Correct. So
Do
the
this. Another thing is
open.
that just close your nose and swallow. By doing this exercise while sitting in the flight, when the descent started, frequently, not every time, say every now and then you keep doing it, and your eustachian tube ventilation is maintained, and it will be solved.
Wonderful, sir.
For
Thank you
frequent.
so much for that tip. Thank you. It helps me as well. Thank you. So now I would want to conclude this session with top tips from you, Dr. Subhankar.
I didn't follow you.
The top tips, doctor. We would want to conclude the
Uh,
session with top.
as I said, especially for children, very young children, so don't wait. Is this because sometimes they don't pinpoint what is the problem? Meet your pediatrician as soon as possible. If you have an ear doctor or suggested by the pediatrician, go and see them. For little elder children, you can examine. You can sometimes you yourself find some foreign bodies inside or wax inside or some pus coming out, reddish, getting and all. Go and meet the doctor. The trick is that you should always address the scenario early so that don't make it complicated. Another thing is that don't worry for wax. If wax happening very frequently, you can use the wax solving dissolving solutions available in the market, and you can get a prescription done from the ENT doctor. Frequently, you can use that. And for the infection like discharge and all, see your doctor early because most of the infection can be treated medically very well. Yes, sometimes if it is not getting better or not improving, getting new complication, you need some surgical corrections to that. And once the surgery is done, it will be done for good. And surgeries are different forms, different kinds of surgeries. The smaller the problem, the surgery is smaller, the result is very good. The more difficult problem, complicated problem, we need to do an extensive surgery. There we cannot give you very good results as far as hearing is concerned. For elderly people, listening, your listening is coming down. You are being able to find it difficult in conversation. Just routinely check your hearing, and the ear doctor will check you. If there are other problems, they will find out. And one more thing I'd like to mention, especially that we missed out in the discussion as no questions came up. For the diabetic, especially, I have to mention that for the diabetic people having their neural functions a little altered, so they have less pain threshold. So there is some infected disease going on in the ear because of the background of diabetes, and it is not very painful. So though they don't address the doctor very early, and they land up in very big problem. This infection can travel from the ear inside the brain and under the brain area, pelvis area, and this is a very difficult to treat condition. And being the diabetic, lot of restrictions for the medicine and surgery to conduct on this patient, and most of the time they're elderly, so there are other comorbidities. So we are very stuck with those kind of people. For especially diabetic people, I want to mention you that if you have any kind of ear problem, you check it early, because your pain threshold is less and you will land up in complications. The chances of complication landing up for you is more.
All right, sir. Thank you, sir. Thank you so much for that very, very patient and very important tip about diabetes as well. Thank you so much for your time on a Sunday morning. We appreciate it.
Thank you. Thank you.
Namaskar, sir.
Namaste.
Thank you. So quickly, I know we're past 12 and I need to do my health quiz. I'll quickly tell you the rules, how to participate in the quiz. I'm going to ask you three questions. Please type your answers in the YouTube chat only, and winner's name will be selected and announced by our team towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And winners, if you are selected, if I take your name to be the winner, please write back to us with all your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. चलिए quickly questions, बहुत ही simple questions है आज के लिए. Get ready and here are the questions on your screen. Fill in the blanks. E से शुरू होता है, E dash R P dash dash N. What is it? It can be a symptom of ear infection or some underlying condition. What is it? E से शुरू होता है and आज उसी का topic है. So that's the clue for it. Question number 2. Yes or no? Severe ear pain can suddenly stopping can be sign of a ruptured eardrum. Is that true or false? Question number 3. True or false में answer कीजिए. People often use ice packs and warm compresses to relieve ear pain. Is it true or false? So these are the questions, and I see our regular participants who have come here for participating in the health quiz also typing the answers. Go ahead. In the meanwhile, let me give you the coupons. The first coupon that we give away today is AskDoc150, AskDoc150. Use this coupon to get 150 rupees cash back on online doctor consultation. You can consult top doctors direct from Apollo hospitals on Apollo 24/7. And the next coupon that we give away today is first 3 FIRST and numeral 3. You get 25% off on online medicine orders, valid on the first 3 medicine orders which are above 1000 rupees, and you can also get 2-hour delivery window as well, and use the code first 3. The next one is HH247 exclusively for our Health Hour viewers. Get 199 off on online consultation with Apollo doctors and 20% off on medicine orders. This HH247 can be used in combination with the other coupons that I've given earlier today. Thank you all. And by the way, you must be knowing that Apollo 24/7 brings the entire Apollo fraternity, entire Apollo facilities to your app. But Apollo 24/7 now can be accessed on WhatsApp as well. 09355247247. This is the number that you can save and avail healthcare services. Just a text or call away if you're looking for medicines. Next Sunday, we are going to talk something interesting other than the medical actual questions. Next week, we are going to talk about health insurance. What is health insurance? Who requires it? How do you claim? What kind of health insurance you need to buy? A to Z of health insurance. We are going to talk about it. And this is important. Not just taking care of your health, but taking care of your financials when you require health insurance. This is going to be the topic for the next week. And this week's winner are Anmol Agarwal. You wanted to become a winner for a very long time. Here you are. Anmol Agarwal, Chandravati, and Manish Sharma. Congratulations. I repeat, Anmol Agarwal, Chandravati, and Manish Sharma. Do write back to us with your contact details at marketing@apollo247.com. Claim your prizes. Chaliye, thank you all. We have short past 12, but thank you for being with us and asking your questions. Namaskar.